And uh, and I had just joined the consortium when it was like, well, maybe we bring, Florida Clinicians for Climate Action and Virginia Clinicians for Climate Action, who are both on stage this morning, and maybe we bring them together with these other groups that have already been. Maybe we start coordinating as a state network. And that has really grown from our first WebEx meeting in 2019. WebEx, who's using WebEx? And now we are a network of 25-ish, I would say, groups, because, some groups have stages where they're growing and thriving, and then maybe there's a little bit of a hibernation. So it's really amazing to look at this map and see how much growth there has been, and will, I know, continue to be. I was just going through and compiling some of these logos, and you can see just the really incredible regional geographic diversity that we have in the state network. And we also have PSR has its own incredible network of state climate and health groups working on climate policy and advocacy and education and all the things you're about to hear on this panel. And Tony, if you want to, I don't know if you want to say a word or two.
Just say, go to the PSR website if you're interested in learning about other chapters, but I should give a shout out to our executive director at the national office. Brian Campbell's here, so if you have questions about other chapters or the national office, speak to Brian, me for Pennsylvania, of course.
Incredible, thank you. And so, but before I introduce our incredible speakers, I just wanted to get a sense in the room. Raise your hand if you are part of a state network group through the consortium or through PSR. Put your hands up. Okay, look at this. And if you're not a part of one of those groups, you can take note of who raised their hand and talk to them if you're interested in getting involved in state level organizing. Because like we learned yesterday, the best, most sustainable way to take soul-sustaining action is collectively with other people. And I think that's something I've heard from our state leaders again and again, that it's working together with people they really like that sustains them in doing this work. So when we were thinking about what would be useful to share on a panel about state level organizing, we got a bunch of folks together, what are the stories that are most impactful to share with everyone? And it really came down to what are the strategies and tactics that are working that can be applied across state level organizing, local organizing, and what can we learn from the incredible wins that we have had already in this kind of young world of state and climate organizing at the state level, and what can we learn from our losses? So we invited these three incredible folks to share a little bit with us about what their groups have done and learned and reflected on. So we have joining us here on stage, Dr. Samantha Ahdoot, who is the chair and founder of Virginia Clinicians for Climate Action, and is also a practicing pediatrician right here in Northern Virginia at the Pediatric Associates of Alexandria, and an assistant professor of medical education at the University of Virginia School of Medicine. And she was elected to the AAP Council of Environmental Health Executive Committee for 2 terms. She serves on the board of the Virginia chapter of the AAP, and many of you know her and love her. She is a force. And Tonyehn Verkitus is here with us this morning, the executive director of PSR Pennsylvania, and also the Northeast Counties Medical Society, as well as being the host of the Keystone Edition Health on WVIA TV. And she has had an incredible career in nonprofit work, mostly focused on food and health. And she's spent many years training organizations and communities on fundraising and telling their stories. And then, as we all heard yesterday, when Dr. Cheryl Holder got a big round of applause and shout out from Camilo, that was really very sweet. Cheryl is the founding co-chair and currently the interim ED of Florida Clinicians for Climate Action. And Cheryl's bio is incredible and packed. And Cheryl, most recently, she was at the Florida International University's Herbert Witham College of Medicine as a founding faculty, where she taught on the social determinants of health. And when she retired last year, it was as the Associate Dean of Diversity, Equity, and Inclusion. In addition to being the co-founder of SCCA, she's the co-chair of the Miami-Dade Heat Health Task Force and a member of the National Academy of Medicine's Climate Collaborative. Oh my gosh, I'm winded. It's too early for these bios. They're too extensive. Can't do it. So really such incredible people, and I want to be able to just turn it over to them and hear from what they've learned in the last 5 or so years of their leadership in their groups, because I think it's really extensive. And just to say, I really believe in the power of state and local and relational organizing, and I think we're going to see the power of that play out today. So I am going to pass it off to Sam to start us off. Thanks, Sam.
Thank you. Okay, great. Well, thank you, Bev. And I have to say it's a real honor to be up here with these wonderful leaders here today who I've admired for so long. So it's my pleasure to talk with you today a little bit about health and climate advocacy in Virginia and share our roller coaster of success and what came next. And to start this, oh, I think that's okay. I'd like to take us back to 2014. And that's really when the first climate policy came to Virginia. A bill was introduced by a Republican delegate and a Democratic senator to have Virginia join the Regional Greenhouse Gas Initiative, which is a regional carbon cap and trade program. It's basically a pay-to-pollute marketplace where the cap on allowable emissions decreases over time. And this bill, by the way, the RGGI, by the way, as it's known, is actually not a Democratic initiative. It was created by a Republican governor of New York, George Pataki, and modeled after the very successful work to reduce acid rain, which was developed by George H.W. Bush. So while this has become in Virginia quite a partisan issue, in fact, it has a very bipartisan history. And 2015 was really the first year that physicians that I'm aware of spoke in support of climate policy. The Virginia chapter of the American Academy of Pediatrics supported Virginia joining RGGI. This letter we delivered to every member of the committee that heard and promptly killed this bill. And RGGI was introduced every year between 2015, 16, and then 17. And individual providers would come to support RGGI, working in collaboration with environmental organizations. We really realized that there was no platform for us to come together. There was no way for clinicians to collaborate, to work collectively to support climate policy. And so a small group of us, pediatricians, internal medicine, a clinical pharmacologist, and a respiratory therapist, with support of our local hospital sustainability manager, we came together and created Virginia Clinicians for Climate Action. And you can see here our mission, vision, and theory of change. And so who are we? Well, VCCA includes all licensed healthcare professionals and trainees. We currently have getting close to 600 members. We have a steering committee, which has about 15 members. We have 2 staff and several undergraduate fellows. Our active committees are healthcare sustainability, advocacy, and education. And I'm very proud that at this point we have quite a wide representation across Virginia. And this picture here is from our 2023 Advocacy Day. And today I'm going to be speaking to you about our advocacy work. And I want to just give a little shout out to our advocacy chair, Dr. Robert Kitchen, who's sitting right here, we're incredibly fortunate to have lead this work in Virginia. This is a picture from our Advocacy Day just a few weeks ago. And I want to say that not only does this allow us to advocate for climate policy, but I think it really is essential, these in-person events, to creating these opportunities for collaboration that we heard about yesterday. Okay, so From 2017, BCCA advocated that Virginia join the Regional Greenhouse Gas Initiative. This is one of our main priorities in our advocacy work. And when we spoke about RGGI, we really focused on the health benefits. And these come from the reductions in the improvements in air quality, from the reductions in particulate matter associated with the program. And fortunately for us, there was two pretty large studies which looked at the health benefits of RGGI over a 5-year period in RGGI participating in neighboring states. And this is the information that we used in our advocacy work. In addition, we spoke about energy insecurity. And that's because when RGGI was introduced in Virginia, it was very carefully designed so that the proceeds from the program, half of them would go to energy efficiency measures for low-income families. This was very deliberate with a lot of input from Virginia's, from diverse groups in the state. And another half would go towards coastal resilience. 5% went to administration. And so addressing energy insecurity was a big part of RGGI from the beginning. And we know actually that energy insecurity is a big problem in Virginia. On average household spends about 2% of their income on utilities. Low-income families spend 7%, and extremely low-income families in Virginia spend almost 1 out of every $5 on their utilities. And that exceeds the definition of severe energy burden that's defined by the Department of Energy. And what does that cause? That means that people are not spending money on medicine, on healthcare, on food, or on keeping their homes at safe temperatures. So energy insecurity is really a social determinant of health that we focused on in our advocacy work. And you can see here in the map, where are these families that are most energy insecure? In fact, most of them, or a large number of them, are in rural parts of the state. So again, every year from 2017 till 2020, VCCA supported RGGI. We wrote op-eds, we met with our legislators, we appeared at press hearings, we made videos. You can see here 2 of our op-eds, 2 of our statements. And then lo and behold, in 2020, Virginia introduced something called the Virginia Clean Economy Act. And you can see here Delegate Rip Sullivan with the blue tie. Next to him is our Senator Jennifer McClellan, who is now in the U.S. Congress, who assumed she took over the seat of the late, great Don McKeechin. And they introduced the Virginia Clean Economy Act. Now, the Clean Economy Act not only had Virginia join RGGI, but also committed Virginia to 100% clean electric grid by 2050. And then it all came true. And sure enough, it passed. And Virginia joined RGGI, and we committed to 100% clean electricity by 2050. Wow, we were going to see solar panels on all of our Walmarts. All of our homes would be covered in solar. I could go back to my clinic and hang up my climate hat. My work was done. And sure enough, man, it's worked really great. So we've brought in hundreds of millions of dollars, right, for energy efficiency measures. And this money is not sitting in the bank. This has actually gone towards improving homes, real projects across the state. You can see here where this money has gone. And also, we've had developed hundreds of millions for coastal resilience. What more could we ask for while we reduced our emissions by 22%? So what's not to love? Well, there are things not to love, apparently. So then there was election in 2020, and our governor really does not love RGGI. He was quite against it from before he was elected. And he then, after he was elected, he pretty promptly issued an executive order withdrawing Virginia from RGGI. He also wanted to appoint Andrew Wheeler as our Secretary of Natural Resources. This went over very poorly with the Democrats who blocked it. So he instead created a new office, a new department, an Office of Regulatory Management, which Andrew Wheeler leads. And Governor Youngkin has worked very hard to remove Virginia from RGGI. I will say that why would he be against it? Well, he does say that Virginia's electricity bills have gone up by about $2 per month for this. That's much less than our bills have gone up to pay for the rising cost of gas. And goodness knows what our bills are going to be as we become because we are the world's hub for internet. About 80% of data centers are in Virginia, and it's expected that about our electricity bills will double as a result of data centers. So he replaced the members of the Air Board. There was many hearings. There was a lot of public comment periods. Virginia BCCA participated in press conferences. We wrote op-eds. Ultimately, though, they did go through the Air Board. Virginia formally withdrew from RGGI in December, and now there's a lawsuit. And it is moving forward. And VCCA collaborated with the University of Virginia Environmental Law Clinic and submitted an amicus brief along with the Virginia Energy Efficiency Council in support of the plaintiffs objecting to Virginia's withdrawal from RGGI. So that hasn't been the only part of this our being at the lower part of this roller coaster. So as I said, I think we all thought that with passage of Clean Economy Act, all of our Walmarts would get covered with solar panel and we'd live in this wonderful green new world. Well, in fact, that isn't what happened. It's much cheaper to put industrial scale solar on agricultural fields and even to cut down forests and put them there. And in fact, that's what's happened in Virginia. And so instead, there's been a tremendous backlash against industrial scale solar. Counties have blocked it, new organizations have formed. And so where did that leave us to move forward? Well, VCCA thought we had an opportunity with parking lot solar. And so we reached out to a partner, Piedmont Environmental Council, which is a wonderful organization that really is dedicated to conservation, works closely with the rural community in Virginia to develop legislation that would incentivize solar on parking lots. And we also brought in the wonderful Virginia Climate Center, which we're very fortunate to have here in Virginia at George Mason. And they did a study, a modeling study of how much energy could we really produce on our parking lots. And it turns out a lot. We could generate about half of Virginia's energy if we solarized our parking lots. And so I just have to say that this list of supporting groups is a very beautiful thing to me. I think when you have the NRDC working with the Virginia Cattlemen's Association, maybe you've found a sweet spot. And in fact, this passed through the Senate with bipartisan support just last week with some very unlikely allies. One of the senators who voted for this bill, his signs for his campaign signs very proudly promote in large letters A+ from NRA. I met with him, his aide, with one of my colleagues at BCCA at our advocacy day, and I have to say we thought we were going into we were ready for just a really rough meeting, you know. And we walked in there, and the young man who's this senator's aide said to us, you know, we're really not so far apart as you think we are.
Good morning.
And he said, I'm 23
Hi,
years old. And I care
Hi,
about
Ms.
this."
Morgan.
So, all right. So that was made me helpful as I get all tearful. So anyway, the way I think of this roller coaster, I really get inspiration from the late great John Lewis, and really realize that we're in this for the long game. You know, this is one day, 1 year, and 1 generation at a time. Thank you.
Yeah, thank you so much, Sam. And I think that those kind of connections you're able to, you know, make with young staffers, it's like hard for me to think that they would have been that open with any environmental group, you know, but he was talking to a pediatrician. Yeah. And yeah, I think that's really beautiful.
Thanks. So thank you for that. And at least I can say that Pennsylvania is a part of RGGI. If anyone knows anything about Pennsylvania, when I was asked to speak about climate policy in Pennsylvania, I was like, Pennsylvania? Okay. We'll see what happens here. We don't have a lot of great climate policy. But as said, I'm with Physicians for Social Responsibility, Pennsylvania. We were originally founded to oppose nuclear war in the 70s, but in the 90s realized that we could use the expertise that we have from physicians and other health professionals to look at some of the environmental health impacts that we're facing across the state. Our core values are education, which is evidence-based education, which is very important to us. Collaboration, we've heard a lot of our speakers talking about collaboration. I'll come back to that, but we do believe that it's imperative if we want to achieve the goals that we want to achieve in Pennsylvania. Being action-oriented for well-being and resilience of communities. Equity, we always want equity. We want to champion vulnerable voices. You can see that through our Community Voices program if you go on our website, where we've recorded stories of local impacted residents so that we can share those with the healthcare professionals that we ask to work with us. And last, empathy, because it's really important that we humanize as we're doing the public health that we do. So, social determinants of health has come up quite a bit. I think it's very hard to have this conversation without that. As you can see in this image, what we're talking about are fence line and frontline communities that are right next to these industries that are pouring out toxic emissions that our children have to inhale while waiting for the bus. As we know, our zip code has a lot to do with our health. Where we live is 60% of our health, basically. So most of our work focused on fracking for the last, I'd say 10 years or so. This map is from Frack Tracker. You can go and look at maps across the country. This is all oil wells, and this does not include the thousands of orphaned and abandoned oil wells that exist in Pennsylvania. Methane emissions are a huge concern for us. And we want to make sure that we're tracking these oil and gas wells, stopping emissions, and protecting the health of our communities. But we couldn't just focus on fracking. As you can see, we have numerous other toxic industries in Pennsylvania. We have legacy industries such as coal. You'll see when I talk about the IRA, they're focusing on black lung. I mean, if we're focusing on black lung, why aren't we focusing on employees that work in our current toxic industries? This is obviously just a precursor. Why aren't we preparing for that? So Pennsylvania does have a climate action policy, a plan. This last iteration happened in 2021. How much is coming from it? I can't really say. We do have some very specific goals in terms of reducing greenhouse gas emissions. By 2025, I believe it's 16%, and by 2050, they're hoping we can get to 80%. But if we're continuing to frack and we have all these other toxic industries, we're talking about hydrocarbons, or not hydrocarbons, hydrogen blending, we're talking about CCS. How do we expect to reduce emissions as we increase fossil fuel output? I don't know if you're familiar with the climate program portal, but this is a great place to find out how much of your funds are being spent in your state on what particular industries. So this is a snapshot of spending in Pennsylvania. As you can see, most of our money is going towards transportation. Electrification is pretty big. They are thinking every home, like the Walmarts, will have solar in a couple of years, that jobs will increase by about 200,000 positions. But really, so far, we haven't seen any of this happening. But we do have something to celebrate, the fact that LNG has been put on the back burner temporarily. So that would be one of our biggest successes, because we have a community, Chester, that's been very concerned about LNG coming to their shores. So how do we do our work? Well, we're mostly concerned about emissions at PSR Pennsylvania. We do want to phase out fossil fuels. This is a #1 priority for us. As a matter of fact, we just believe that there's no safe way to frack. We don't like to be too aggressive with that statement, because then people think we're activists, which we are, but that's okay. So we say it more nicely, let's phase it out. We're very concerned about methane, because we know that that's actually worse than CO2. And we want to increase how we're educating healthcare providers. I'll talk a little bit more about this later, but we also do webinars. We've done film clubs. We've spoken to researchers that can share their expertise with our physicians so that they can do their work better. I also wanted to highlight the FLAIR OGI program that we have. our environmental chemist, Christina DiGiulio, is here. If you have questions about flare OGI, please feel free to ask her. But we were fortunate enough to get this camera last year, which actually highlights emissions from toxic industry. It shows you hydrocarbons. So the little, what looks like smoke coming out of those stacks are actually hydrocarbons that are being emitted into the atmosphere. We go out and we regularly look at different industry to see what's being emitted. And actually, just 2 days ago, I was on a call with Brian at National, and I get a phone call from my staff saying, the police are coming. What should we do? And I was like, can you guys hold on a second? Because they were out there capturing emissions from some huge industry that's right outside of Philadelphia. It's called Marcus Hook. Actually, some of you might be familiar. And people who work for Marcus Hook came out and told us that we weren't allowed to image, but we were on public property. And you can't exactly stop us from looking at what's in the air. We're not going into your facilities. The police came along. They were much kinder. They told us that we weren't doing anything illegal. And if you go look at our Facebook page, you can see the live stream of all of this happening as it was going down, but no one was arrested. We were told we could stay. And once again, we did capture some pretty horrific emissions coming out of these industries. But on top of all of this, to me, it's really important that we talk about solutions. We constantly talk about the bad news. We have people concerned. We have families worried for their children. But what if we talk about solutions as well? There are positive actions that are happening out there. So we just want to make sure that we're sharing those, even as we're telling you the bad news and asking you to come out and advocate with us. So here are some of the strategies that we use in Pennsylvania. First and foremost, we have concerned health professionals. This is a group of healthcare professionals, nurses, pharmacists, physicians who are working to oppose fracking. That is their only concern and mission. They do lots of comments and testimonies, LTEs, and op-eds. If anyone's interested in learning more, I'd be happy to share. We also created O-Career, which is a climate and health certificate. It's a 4-credit CME CECEU for social workers, pharmacists, nurses. Medical students can take it, physicians as well. But what we did with O-Career was try to define climate change for people, but then also create a practical mnemonic and tool that can be used when health professionals are speaking to their patients. And we actually attached it to ICD-10 codes so that these can be coded while taking a patient's history. And therefore, climate effects or social determinants of health become a part of a patient's history. So when you're having conversations later about why this person may have cancer, when they did not have a genetic predisposition, maybe we'll find that they lived in a community next to one of those emitters that I showed you earlier, which can help inform why they have the diseases that they have now. And then I just put this little thing at the bottom that highlights some of the things that we did in the first quarter of this year. We now have over 100 air monitors in place. We normally follow flare OGI with the monitors. Once we capture something, then we want to collect data, qualitative and quantitative, so that we can use that data to support communities, their local organizations, and impacted residents while they're developing policy and advocacy on the ground where they are. And that's obviously different for everyone. That's why we have to work with the communities to understand what their priorities are, not ours. Got to give a shout out to National. They have these 2 relatively successful programs that they've run for a while. Again, if you're interested, you can talk to Brian about these. But these 2 programs also work very closely with physicians and students on advocacy issues. Last, I wanted to highlight some of the good work that we do. And actually, you were there at the March to End Fossil Fuels. We did lead the Healthcare Professional Hub, which was very exciting. But this sort of advocacy, I always think, is relatively easy. You show up, you carry a sign, and that's great. Please don't stop doing that just because I called it easy. But how do we actually do better? So some ways we can do that is by creating climate and health courses for pre-professionals. So we should be talking about climate and health before people get into their professional scope so that it just becomes a part of the lingua franca, right? We all want to talk about this, not just those things that you can test with a thermometer. We also should be talking about how we give professionals time to advocate in their professional workspace. We get vacation days. Why can't people be given a couple of hours per month to advocate for those issues that are important to them? And why aren't health systems teaching climate health impacts to the physicians that work for them? As it was stated, I am an executive director of a medical society as well, a multi-county medical society. I can get physicians to come out for that child abuse. I know it's required every other year, but what if we made climate health a requirement? Why is that not a requirement? So everyone go talk to your state medical societies and put in resolutions for that, because I think that's really important. And last, how do we continue to keep sharing the good work that people do? Often we have the same people out there doing the same fight day to day, and it's really draining, and there's very few successes. So A, let's lift up the people that are doing this work because they've been relatively successful. It is a marathon, not a run, as they say. And I have a feeling that this marathon will be going on for quite some time. And in closing, I'm a bit of a dork, I guess. I love mushrooms and fungi. I don't know who's familiar with Susan Simard, but she is like my hero. Yay! There was this fantastic article in the New York Times called The Social Life of Trees. And I took this quote from that because I think that this really stands for how we have to act in society. An old-growth forest is neither an assemblage of stoic organisms tolerating one another's presence, nor a merciless battle royale, though that's what it feels like often. It's a vast, ancient, and intricate society. There is conflict in a forest, but there's also negotiation, reciprocity, and perhaps even selflessness. Thank you.
Thank you so much, Tonyehn, and I love that last slide, and I also love like learning about mycelium networks and all of the ways in which we can mimic nature and being collaborative and learning from one another and working together. Thanks for bringing that in.
Thank you. Well, I'm here telling from a red state, very red state with a supermajority Republican that has, for 8 years, the governor did not even mention climate change. It was illegal. And the new governor does recognize climate change, but it's only really about adaptation and no interest, zero interest in any sort of efforts on recognizing human cause. And you guys saw him, he was campaigning, Governor DeSantis, so you know what he believes in, but he does control our legislator. And whatever he says pretty much goes. So as an advocacy, or as our organization, how do we tackle this? With our limited resources, what should we do? So FCCA, we were established in 2018. Any first children out there, first child, their only children? Yep. Oh, there are a lot of you guys. So you understand how much your parent pours into you and what happens, and that's why there's so many of you here. FCCA was one of the first born, I see, of the medical society. So Mona and Mark and the organization poured into us. So much of our ability to do what you'll see what we've been doing comes from that first child effect of getting so much resources. So when we were founded, we got an executive director that was amazing, had a lot of contact with advocacy and around the state. And she was partnering with one of the top lobbyists in environmental work, who also supported FCCA. So building on that, we were able to really develop an advocacy committee that could effect a lot of effort in a state where you're basically non-starter. So much of our work, you'll see what we do. So we're here, but we have about 4-something. We do lots of multi-activities. We have a very good advocacy committee that is run by a doctor out of Orlando, very passionate. And it builds on our basic tenets like all of our CCAs: educate, advocate, engage. And so all of our activities are based on the education and a lot of collaboration because we're very small, little funding, not little, we do okay for what we have. And if you look at our funding, and I always say, look at your funding, where your priorities. A good third of what we collect goes towards our education effort around policy and engagement and advocacy. And you all know heat is what we have focused on in our work for the last few years. It does help funding, but it is priority. You know, we hit the 1.5 last year. I don't know if it made front pages in all of our states, but that was pretty just sad in a way that we didn't scream and yell that we failed one of the accords that we did in 2015 with our Paris Accord, and it wasn't a major reset, but it does relate pretty much to what we feel in Florida. And so we went local. So FCCA used the same strategy that you saw Virginia use, that you see what PSR does in advocating and getting the groups together, identifying the problem, how are we going to work with the state level. We decided to really focus our efforts on the local level because there was some opportunity locally to tackle heat, especially heat for outdoor workers. This process started with lots of work and mapping and understanding, but 2021, if you saw my first thing with the collaboration, if you look at the funding, we got resilience dollars from the state and from all the federal because we will do adaptation. But building on the resilience dollars, we were able to get dollars in from a foundation, Adrian Arsh, which funded heat. And so with that money, we were able to get the heat officer. Then Kresge, which funded Catalyst, worked on developing policy. And one of the most important things that we did with that Kresge dollars was we went to the community and we asked the community, what's the most important thing to you? The answer came back, heat. We had spent millions on raising all the sidewalks of Miami Beach because of sea level rise and sunny day flooding. We spent millions on so many other things, and the community said heat. So along with everyone else in the community, we were incredibly, as a clinician organization, that also is, when you look at health, heat just encompasses everything that we talk about. And so when this campaign came up in 2021, which is to get the outdoor workers protection. Prior to this, there's been a bill that came up for 5 straight years in the Florida legislature to simply say, let's educate the workers who are exposed outdoor to be able to protect themselves. That never left committee. It made out a committee, one level of committee once in the 5 years before. So it was hopeless in the state level. So we decided, and with the group, with We Count, to go local. We have a blue dot of a blue mayor who would work towards this. And Watershade Rest became the huge campaign with this organization that works for outdoor workers. We have a huge farm worker. About 80,000 people are impacted by this. If we can get the construction workers and the farm workers, just 10 minutes of rest, that's it. Every 2 hours, when we get a heat index above 90 degrees for about, and they had anticipated maybe 5 days at most. We know 2023 proved them wrong. But when this was started, the campaign started, and we got it through committee. Now, what did we do as FCCA? We participated in educating about health to the workers. We went out there in the community. We also testified and we rallied medical students, there were nursing students. The health group was large, and we showed up at the commission's meeting. We showed up in the community. This is at the commission meeting, this was the, I always block on the word, where we show all the workers who have died from heat. And Efrain Gonzalez was one of the workers. last year in July, he died in the fields, age 29 or 26, really young man, died in the fields. So we had this, and we were there pushing the health message. And so if you think the health message is not, it is so important. And when it comes from the doctors, and we were there, everybody testified. We also have CME courses, and we did courses throughout the county in all the health centers. And every time we went out, we brought in what's happening to outdoor workers, and we tried to let folks know what was happening so then we could support. We went to social media. We did it also, the students made social media posts. We brought folks involved in letting the message out. We had Action of the Month. We have a newsletter that we send out to all the folks, about 500. Our advocacy newsletter, which is separate from our regular newsletter, has a 70% open rate. Most of the supporters and members are doctors and clinicians and nurses, and 70% open it. And when we put call to action, some of our call to actions were call your politician, call this, and we put the numbers. We had like a 50% uptake in the call to action around heat. So we used this opportunity to develop our advocacy within FCCA, develop the outreach, develop the strategy that we think we could use for other campaigns as now we're moving towards voting, because that's going to be our push, because we've got to change the legislator. We do a lot of activities. These are some of the advocacy activities. We did a lot of across the state, even though it was a local issue, we were able to get this in the national news. And that's with articles, they interviewed us, they interviewed students, they interviewed across about what is happening with this ordinance, because it was such an opportunity. Our medical students from University of Miami, from FIU got in the newspapers with their articles. Our pharmacist, who was our advocacy leader, got into Orlando. So we took this issue and went statewide and national around a local issue. And that's at the commission meeting. We were filled with lots of nurses, doctors, everybody came out. And unfortunately, we got to the third round in the commission where it was passed forward, and the third round where it would be law. The opposition kind of spoke, and the money spoke, and they said no. But the commissioners, because there was such support in the community for this, because we made a big effort that everybody knew about this, everybody supported it, they couldn't take the vote. They couldn't vote no. So what did they do? They postponed it for March 2024. We were set. You can see this, September, we were set to make the history to have an ordinance to protect outdoor workers in a red state, 80,000 people, and the lobbyists unfortunately delayed it. So what does that delay do? Preemption, which is the huge thing that the state does. In a supermajority, every time there is some local ordinance that protects the workers from anything, they then go to the preemption. And this is moving very quickly through committee, and it basically says no county, no one can require anyone to provide heat exposure education or anything. So if it comes from the state that says you cannot do it, our local ordinance will not, even if you pass it, they won't pass it because it's now illegal. There's one other preemption that went in that you could be sued. It was law last session that if anything you put in by a local organization could cause some economic loss to a business, the business could sue the county. So between this and that other law, any sort of ordinance is gone. And so we're shifting to going back to that old bill. And so we're using our call to action, at least get some education. And we're going to work again to try and get the OSHA and everybody else to do other things. So we're revamping. But, you know, it wasn't totally a loss, because when you think all these groups came together, and at that commission meeting, everybody was there. The farm workers, they were just so happy that for the first time, everybody was listening, and they weren't the only ones in commission meeting. It was the farm workers, it was the doctors. We had 4 university professors coming out to testify why this is such a health issue. And health was foremost front, and the doctors were there speaking the truth, and everyone supported it. So health is the real key. I mean, that's what we want to do, is save lives as we protect the planet, not just our lives, but the trees and the insects. 90% of the reptiles may be extinct. It's just shocking what could happen. And that's where we see our future really is to continue the education, engagement, advocacy, but using the strategy of building locally, building that voice, strengthening your skills so we can really tackle the voting issues. And when the right legislator comes together, we're prepared. Thank you.
All right, so I'm going to share a little bit about what I'm reflecting back from that conversation and what I've seen from behind the scenes supporting state groups. But I know that yesterday we ran out of time for audience questions at a number of panels, and so I want to prioritize that. So if folks who have questions want to make their way to the mic, or think if you have a question, well, will I do a little speaking? I want to make sure that we do get to those questions. So if you have a question, you want to make your way up, that would be great. But I just wanted to say, I think there's like some really incredible examples shared, and I have gotten to see all of what has gone into that, all of the emails and calls, and trying to figure out what is a 501c3 versus a fiscal sponsor, and can I figure out how to make this graphic last minute in Canva, and having all these long conversations, and just that, seeing, VCCA's huge lobby day, that started very small, and that it took just a lot of years of good, intentional organizing and just continuing to build relationships and bring people in and have hard conversations and keep going. And that's, what got these groups there. So just seeing, from behind the scenes, getting to watch that and seeing what's grown from it. And just the themes of, everything that's been possible with coalition and collaboration, and when just, that's so, like, the relationships that I know were built in Miami now will lead to more work and more advocacy, and that's really what's going to grow things. And knowing how in Virginia, like VCCA has become the group that environmental organizations turn to when they need a health person, and that relationship, and I know that it really got the 2020 legislation over the line, having the health voice as a part of that. And just, being out in the community, and, I think both in Pennsylvania and in Florida, of just participating in activities and workshops and education to make those connections that then really serve the advocacy goals. So I think Savannah, I think, is representing our virtual folks. So if you want to read that out, Savannah, I want to make sure we hear from them. I don't know if the mic's on. Yes.
How about now?
Great.
There we go. So we have a question on Zoom from Shelly Manlev. How do you digest or deal with disappointments and losses?
Okay, and just repeating that to make sure our virtual folks can hear, that's how do you digest and deal with disappointments and losses? And Shelly recently helped start up with Paul in the audience, a group in New Mexico. So that's exciting.
I can start because I was we were so hopeful because we got through to the final vote, and everybody was, they'd done some pre-checks of the commissioners, and there were enough, it seems, that would take it over. But then the op-ed came out from this gentleman, Perez, who is a billionaire and controls all the construction, and he came against it. And when that was published, we knew. Now, the hardest part was to help the farm workers who had spent 2 to 3 years, and I'm saying these are really tough work, fighting for this. And I think for me, that was the hardest part, to see the disappointment on their side. and the loss that they felt because they were so close. But we in the medical side, just seeing how we managed it was looking at what came out of it, that strength, that relationship. How the farm workers have managed it has been getting together again and finding some other avenue. When this preemption gets voted on, because we're still fighting this preemption, if it does, then I think we will go back with the community. And again, as clinicians, we'll be able to manage the loss and grieve through it. And then we get together again and push for some other ordinance, as long as this mayor, right now we're fighting to get this mayor reelected. So I think we're going to focus our efforts on keeping the mayor elected and getting more allies into the fight. So that's the strategy, but also as clinicians, we're going to work with the farm workers to manage the loss. And there's one other area that we could use is a disability law that Florida has, and perhaps we could help get the folks who have some documentation, disability protection. So we're going to offer what we can as clinicians, finding other solutions. But it is tough. But I like to grieve the loss and then move forward. And so that's what we'll do.
Yeah, I think I'd just say, I think every loss is a lesson. Because what we've also learned is that wins are often losses. So we have a community that for 13 years had a fight over poisoned water. When they finally won the lawsuit and they were rewarded hundreds of millions of dollars, silently that night, the moratorium on fracking was lifted in the same community. So are there ever really wins? And every loss just gives you an opportunity to be more creative and to think about how you're going to come up with tactics that are unexpected. And that's what we find ourselves doing a lot. So we pretend actually that we're the DEP at PSR Pennsylvania because we don't believe they do their job. So our job is to ask the DEP to do their job because we have a lot less funding. So with the OGI images, for instance, we're not going to tell you what it is. You need to tell us it's not something. So we don't really deal with wins and losses just because it just seems that it's kind of like this inevitable cycle of, regrets and small joys, but instead let's ask people to do their job.
I find so many parallels, in Virginia, that the wins create unexpected losses, which ultimately can end up creating new collaborations and creating new opportunities. For example, Virginia has a lot of challenges around distributed solar energy. Our utility makes it very, very hard there's the incentives for putting up solars on your house, or they're really much lower than in other places. It's amazing how sophisticated the efforts have been over the decades to prevent distributed solar in Virginia. And I always thought that wouldn't putting energy on your roof be wouldn't conservatives support that? It seems like they should, but it never has really resonated. And somehow maybe this objections to industrial scale solar will end up creating more support from conservatives for distributed solar. And maybe there's going to be new ground and new collaboration on that. So it's the roller coaster that Rob described yesterday, and it just keeps going and going and going. But maybe gets a little better every time.
Thank you for those answers. A question here? I think you got to turn it on potentially.
About now. Okay.
Yeah.
Hi, I'm Bob Fader. I'm a member of another one of the state affiliates of the Medical Society Consortium, the New Hampshire Healthcare Workers for Climate Action. Our executive director is also here, Emily Thompson. Give her a wave. And I don't have a question, but I have a couple of comments. The first is that I'm really glad that the consortium did this session because I think most of the important work that's going to be done in climate is going to occur at state and local levels as opposed to the national level. And I think it's really important that the Medical Society Consortium continue to develop and support its state affiliates, because that's really where the action is. And I really appreciate all the work that the representatives from these states are doing. I had one comment in regard to the location of solar arrays, which it sounds like you're struggling with in Virginia. Just wanted to let you know that I've been noticing in New England now, a lot of big arrays are being put under major power lines. So it may be something that you consider, because these are often in wooded areas that have already been cleared for the power lines. And nobody objects to this. It's not creating a problem by being there. So one thing to, consider in your struggle in that.
Thank you. I will say that power lines in Virginia are kind of an interesting environment. We have a very nice organization called the Clifton Institute, which really evaluates and studies native plants and insects and other species in Virginia. And they did a study of obviously we've been losing a lot of grasslands in Virginia. For decades, we have very few grassland birds left. It's a major problem. And it turns out that the area under our power lines is some of the richest environments for insects and native plants. And I thought that was really interesting. And in fact, when you drive around Virginia, you see, I think it's because they're only mowed maybe every year or two, and they're not otherwise disturbed by human activity. So there's always a balance, right? So a lot of, but I thought that was interesting.
Amanda, are you up for a question? I think we have time for one more. Yeah,
Okay.
go ahead.
I'm going to ask, I think this is okay to ask. I'm curious, do you have 501c4s that are affiliated with your C3? And if so, or if not, how did you come to that arrangement?
We became a 501c3 this last year, and we have to track 20% of what you do based on our training, and is you can do lobbying. We do frame everything else as education. So we do educate around health. We only took on the heat because we had to really step up for the community. Now, how do we track it? You have to track it. One thing I have to say, you have to put money into your advocacy and into your managing your social media and your external communication. So we've had our external communication folks help to track how many posts we make that would fall into the move away from education. And based on those numbers, we get a monthly report back, and we even have a trigger when you go past 4, they notify us. So that's where our capacity building dollars that we got from Solutions Project and from what we'd received from the Medical Society, we put into that aspect. Our lobbyist, who's not for us is our education specialist, but she's a lobbyist in our another hat. We taught her how to do the 501c3 regulations, and when she works with us, how we keep it as education so we don't trigger. But we do believe in embracing our 20% because you have to step up for your community.
Can I just add to that? If you have an H election, then those hours actually roll over every 3 years. So this year being a big election year, we didn't use very much in the past 2 years. So we can take what we didn't use over the past 2 years and apply it to this year, but you just need to know when it rolls over.
So unfortunately, we are at 9:34.
I want to add, we all are in this thing about whether we can lobby. I suggest any nonprofit look at the 501H and comply with those, because that's how you implement what you guys have just said, 501H.
Okay, great, love that. Thank you for coming up here this morning, bright and early, and sharing your stories. And I've learned, and I'm always learning a lot from all of you. And I think that just something that's come out is how clear you are about what we're up against and who these stakeholders are and what their motivations are, and that like these agencies are not going to come through for us, and we're going to have to keep being on them. And like, we know which lobbyists and which power are going to continue trying to influence our policymakers, and like being really clear about that, and still having a lot of hope and vision, and like continuing to, like a forest, compost the losses, and then things are reblooming, and maybe there's a massive fire, but then everything regrows. And I think, yeah, just that, seeing that process is really quite inspiring. And so I hope that this conversation continues, and you all looked around and saw who else is in a state group. And if you're not in one, I hope you might consider making one of them your home, or starting one in your state. And so come talk to me about that. All right. Thanks.